Hello students, welcome to another class. Today we shall be looking at common sports injuries and their first aid treatment. In the previous lesson, we learned nutrition for special groups. We defined nutrition as study of nutrients, also defined nutrients as chemical substances. We looked at the four groups that need special nutrition. These groups are the sick and convalescent, the school children, the adolescents, and the athletes. But today, we're looking at injuries, sports injuries. We'll be able to define injuries at the end of the class. Sports injuries, know the causes of the various injuries, examples of these common sports injuries, and the first aid treatment of the sports injuries. What are injuries, if I may ask? Injuries are damages to any part of the body that may allow the escape of blood as a result of accidents. What we are saying is that when injury occurs, there might be outflow of blood or there may be no outflow of blood. This injury can affect any part of the body. What are sports injuries? Sports injuries are the injuries we get during participation in sports. When you do sports and you get injured, that injury is referred to as sports injury. The injuries can be as a result of human factor. It can also be as a result of natural factor. When we say human factor, we're talking about negligence on the part of humans. When we talk about natural factors, we're talking about natural disasters beyond human control. Examples of these common sports injuries. Examples are dislocation, strain, fracture, wounds, sprain, drowning, muscle cramps, bleeding, etc. When these injuries occur, there is need for first aid. What is first aid? First aid is the first and the immediate treatment given to an injured person before taking the person to the hospital or before the arrival of a qualified medical personnel. One thing we must note is that not everybody is qualified to give first aid, which means a first aider must be a qualified person who has the knowledge and knows how to use the first aid box in handling first aid emergencies. A first aider must and should always try to save life and reduce bleeding as much as possible. This he should do while encouraging the victim before the arrival of a medical personnel or before taking the person to the hospital for further treatment. When injuries like fracture and dislocation occur, the first aider do not try to put back the bone or to mend the broken bone. The first common injury we want to look at is strain. What is strain? Strain is an injury to the muscle or the tendon. The muscle with the bones help us move. The tendon is the white tissue that connects the muscle to the bone. When this tendon is injured or when the muscle is injured, we say a strain has occurred. A strain mostly affects the ankle. If you see the red spot on the picture, that is the Achilles tendon. The Achilles tendon at the ankle is the part that is most prone to strain. And when the strain occurs, the victim finds it difficult to walk and experiences much pain. The second spot injury is sprain. Sprain is the injury to the ligament as a result of overstretching. What is a ligament? A ligament is a white connective tissue that connects two or more bones together. When you look at this picture closely, you will see a tissue connecting three bones at a time, the right bones. That is the ligament. When the ligament is overstretched, maybe you miss a step or there was hard impact on a joint, you experience sprain. Sprain affects only the joints. The next type of sports injury we want to look at is dislocation. Dislocation is the displacement of one or more bone ends at a joint. When there is a displacement or there is a shift in the position of a bone, when the bone is no longer where it is supposed to be, we say a dislocation has occurred. Let's take a look at the next slide. You see the feet of this person. The left ankle is dislocated. Hence, you can see the swelling compared to the right ankle. That is one sign and symptom of dislocation. The next type of sports injury we'll be looking at is the fracture. And what is fracture? Fracture is a break in the continuum of a bone in the body. The first type of fracture we have is the open fracture or the compound fracture, where the bone pierces the skin and we see the bone outside on the surface of the skin. The second is the closed or the simple fracture, where the bone is broken but the skin still covers the bone. The third is the incomplete or the green streak fracture that affects children. In this one, a part of the bone is broken but it's not completely broken. The first one will have a complete fracture where the two bones are separated but the part of the body is being held by the flesh or the skin. We have the displace where one or a bone is broken transversely. We have the comminuted fracture where the bone is broken in pieces. First aid treatment of these common sports injuries. In subsequent slides, you will be looking at the first aid treatment, because when this injury occurs, there is need for first aid treatment to save life. There is need for first aid treatment to save life. So the first one is sprain. And
in this tutorial, we're going to look at the treatment for strains and sprains. Our treatment for a strain or sprain is, we use the acronym RICE. You rest the injured limb, you place ice on it, you put a compression bandage on it, and you elevate it. Our casualty here, I'm going to expose the injured limb. I'm going to use my kit bag here and I'm going to elevate the limb. Next thing, I want to put some ice on it. So when we use an ice pack, we never put it directly on the skin, we always use a bandage. Here I have my instant ice pack. I'm going to break, distribute the contents evenly. Now I'm going to wrap it up. And now I'm going to place this over the injury. I'm going to leave this here for 10 minutes to cool down the injury and also help reduce swelling. After the 10 minutes, next I'm going to use a compression bandage to put compression or apply pressure over the injury. They come with a clip. We're going to discard the clip and we'll use tape to secure it. So you start above the joint, secure your bandage, you come down and we're going to do a figure of 8 around the injury and back up, and we're going to keep doing this. We're going to use the whole of the bandage and keep it good and tight. So continue doing our figure of 8. As you will notice as we're doing it, the heel is going to remain exposed, but we're keeping good pressure on the injury to keep the pressure on the joint. So once you come to the end of your bandage, again you're going to use the whole of the bandage. I'm going to secure it here around the ankle. Again, open it fully And again, I'm going to use 2 pieces of tape to secure the bandage in place. And our last part of the treatment, we need to keep the leg elevated, and as you can see, it's elevated here on my kit bag. And that is the treatment for a sprain or strain.
A broken bone is the common term for what doctors call a fractured bone or simply a fracture. A broken bone is a bone that no longer has the same shape it normally does. Bones can be broken in a number of ways. This can include a straight break directly across the bone, a diagonal break through the bone, a crushing injury to the bone, when the bone is broken into several pieces or fragments, and when bones are driven together, crushing parts of one another. In addition, broken bones can be closed or open. A closed break means the skin is not broken. An open break means the skin is broken and the bone may be sticking out of the skin. Open breaks are also called compound breaks, and there's an additional risk of infection with this kind of break.
So if you find yourself in emergency situations, follow these safe steps. In the case of broken bone, call the emergency services and don't move the person unless absolutely necessary. Keep the injured area still and supported. Don't try to manipulate or realign the bone. To alleviate pain and swelling, apply ice. Wrap in the cloth without moving the affected area. Don't place the ice directly on the skin. Keep the victim calm and in a comfortable position until help arrives. If you find yourself in the right place at the right time, be prepared to save a life and follow these safe steps.
Support the injured area. Cover the wound with sterile dressings. Build up on either side of the fracture with bulky dressings and secure in place. Splint the injured area if you need to remove the patient. Secure the splint with bandages above and below the injury site.
In this health sketch, we want to talk to you about CPR, which stands for cardiopulmonary resuscitation. We use CPR when someone has collapsed and is not breathing because it can keep people alive until emergency services arrive. Learning these simple life-saving skills is as easy as ABC. All you have to remember is the doctor's ABC. D is for danger. First, look around carefully to make sure the area is safe for yourself and others before approaching. R is for response. Shake them gently by the shoulders and ask them loudly, "Are you all right?" If there is no response, you need to. S. Shout for help, as any assistance will be helpful. A is for airway. Gently tilt the head back like this to open up the airway. B is for breathing. Look, listen, and feel for signs of normal breathing. Look for normal chest movements. Listen for normal breathing sounds. And try to feel their breath against your face. Do this for no more than 10 seconds. If there is no sign of breathing, or if they are breathing in an unusual, noisy way, we need to start CPR. First, make sure that an ambulance is on its way. If you have someone with you, ask them to make the call. Putting the phone on speaker mode is useful as the ambulance service can talk you through the steps. C is for circulation. Circulation means the flow of blood around the body, and when the heart stops pumping, we need to take over this role by pushing down hard and fast on the chest. Start by placing the heel of one hand at the center of the person's chest and interlock your fingers like this. With arms straightened, press down hard and fast, letting the chest come back up fully each time. Fast means around 2 times every second. And hard means that the chest needs to go down by about 5 centimeters. This might sound a lot, but you do need to push hard for it to be effective. If you have been trained, you can give 2 rescue breaths after every 30 compressions, as this helps provide some oxygen. However, if you have not been trained or are not comfortable, Just keep going with hands-only continuous chest compressions. If someone else is with you, swap over if you begin to feel tired, and don't stop until either a health professional takes over or the person is definitely breathing normally. Sometimes we can add another step. D. D is for defibrillation, which is about delivering a shock to restart the heartbeat. Some public areas and workplaces have an easy-to-use defibrillator on site called an automatic external defibrillator, or AED. Automatic means that it is the machine that decides what to do, so you can't go wrong, and it even talks you through the steps. If there is no AED available, keep going with CPR until the ambulance arrives. That's it.